focusing on public policy and focusing on making sure that every child has the opportunity to succeed. This challenge, this danger presented by coronavirus for us really presents a number of challenges for children and for families, and we're determined to make sure that we're doing everything that we can in terms of awareness and information, and hopefully putting pressure on public policymakers to also make some changes to protect our children and families. One of the things that we've worked on around this, next week there is a public hearing for the Texas House as we focus on public policy in Texas around health. And we'll have some representatives there talking about the coronavirus. And we'll be asking for a couple of things. And one is that we want to make sure that there is complete transparency in what's happening in our state and in our country around the coronavirus. We want medical officials, public officials, no matter where in the chain of events they are, to be able to be completely transparent and give us, as the general public, all the information that we need so that we can determine what's happening around the coronavirus. The other thing that we'll be asking in this committee is that we really focus on health workers and first responders. One of the things that we've seen with the coronavirus is that health workers are some of the first people to be impacted by this. And so we want to make sure that we're protecting these health workers, these first responders. I think additionally, one of the things we understand is that in general, there are a lot of families in Texas, a lot of children that don't have health coverage. And when you don't have health coverage, whether you're here documented or undocumented, sometimes you're a little bit shy about seeking medical coverage, shy about seeking some help. We don't want this to be another public health concern for us. We want to make sure that we're doing everything possible so that everyone in the population feels like they can seek help during this potential health crisis. We know that at the federal level, the federal government has passed legislation to send more money to the states around public health. We need to make sure that our public health structure is properly funded to do all the work that's necessary around the coronavirus. And then finally, we have here in Houston the largest medical center in the world. We also have a lot of experts, and we'll hear from some of them today, who are working on the virus and vaccinations around the virus. And we need to make sure that we can continue to be the center of prevention when it comes to the coronavirus and to immunization. These are important things for us in the state of Texas, and we hope to continue to press to make sure that we're keeping our families safe. I also want to mention one more thing around our schools. If and when our public schools get shut down and we want to be protective of our children, we need to understand that our children, right now children seem to be relatively less impacted by the coronavirus, but that doesn't mean their families aren't going to be impacted, their parents or their grandparents or their caregivers. And so if and when we close our schools, we need to make sure that families understand that they need a plan for what's going to happen with these kids, and our schools need to help in terms of, is there going to be online learning? Are we going to use technology to do some of the right things in regards to our kids? Let me bring up a couple of experts to start talking about some of this. I want to first bring up Dr. Mitra Misra. She is with Texas Children's Hospital. She's the director of the mobile clinic program. Doctor.
So I'm speaking on the concept of Texas Children's Hospital and our response to the coronavirus. So Texas Children's, in conjunction with federal, state, and local health organizations, is monitoring the situation very closely, and we are prepared to safely serve patients with severe respiratory illness. Texas Children's has a detailed plan in place to identify, isolate, and treat suspected cases of contagious infectious diseases. In steps with the CDC guidelines, we elevated our screening activities weeks ago based on our protocols at all Texas Children's facilities. In partnership with physician, nursing, and administrative leaderships, Texas Children's Infection Control has facilitated this screening process, which is currently taking place across all facilities at all entry points through Texas Children's. We are closely following the CDC and updating our screening protocols as necessary based on their guidelines. Texas Children's Hospital's highest priority is the health and safety of those we serve.
All right. Very good. Thank you very much, Dr. Misra. Allison Wenicky is here from the Immunization Project Partnership. Come on in.
Hi, I'm Allison Wenicky, and I'm the president and CEO of the Immunization Partnership. We're all very worried about the coronavirus, and with children in particular, the CDC has 3 recommendations for children and their families to take to protect themselves from the coronavirus. First, cover your coughs. Second, use soap and water to wash your hands regularly. And if soap is not available, use sanitizer. And 3, keep up to date on your immunizations, particularly your influenza immunizations. With regards to school closures, health officials and government officials do have the authority to close schools if it's necessary to protect the public's health. Right now in Texas, no schools have had to be closed because of coronavirus spread, although we have seen school closures in some localities in other states and of course in other countries as well. Now, school closures would not be something new to Texas. In fact, last year we had over 30 school districts in Texas closed due to flu outbreaks. So this is something that we do have experience with. A difference with the coronavirus is that it could be sustained and widespread school closures if that does happen in the future. So it's important that school officials work very closely with our health officials to determine if school closures may be necessary in the future, and in turn to work closely with parents, because this would be a drastic change and it would be something that parents need to plan ahead to make sure that there are appropriate safe places for their children if they are excluded from schools. Thank you.
Thank you very much, Allison. Dr. Peter Hotez is here. He's the Dean of the School of Tropical Medicine at Baylor College of Medicine and an expert in this area. Peter, you were testifying at Congress yesterday, right? Yeah. You did an excellent job, I must say. So, Peter, come on up, say a few words.
Thanks so much for having me. I hate standing behind the podium because someone of my stature, when you stand behind the podium, all you see is podium. So, but we'll try to make it work. Would you like to just make a few statements?
Yeah, please.
Yeah, I mean, one of the things that I said in Washington at the House Science Committee is this epidemic is already showing some signs in Seattle where there's significant levels of transmission underway that very much resemble what we saw in Wuhan in central China. And I think the fact that it's occurring both in Wuhan and now for the first evidence of transmission in Seattle gives us a pretty good idea what we might expect in other communities across the country. And let me tell you some of my concerns that I talked about in Congress. One of them is our older population. And we had a heads up from the Chinese that we talk a lot about case fatality rates, and there's a lot of hand-wringing. Is it 0.5%? Is it 1%? Is it 2% or 3%? In fact, that's a lot less relevant than the fact that what we really have to worry about is the case fatality rates among individuals over the age of 70 are approaching 10-20%. And that's a huge red flag. And that means that we have to really look after our older population, and it's all hands on deck in keeping them protected. Unfortunately, we did not do that in Seattle. As this virus ripped through a nursing home in Kirkland, Washington, it's so far, my understanding is it's killed 11 people. So of the 12 deaths in the United States, 11 were at that one nursing facility. And there may be additional deaths beyond that. So the term I use that's getting picked up a lot in the press is, I call this virus, as it goes through a nursing home, an angel of death. And so we really, I think, in terms of messages for our public health authorities, we have to learn from that lesson. And those deaths can't go in vain. And that means as we start seeing community transmission, and we really haven't seen that yet in Houston, but if we do, then that's going to be a top priority to protect nursing home, assisted care living populations. That's one. I think a second one that that was explained to us by our Chinese colleagues as they were putting up data on bioRxiv and elsewhere is the effects on healthcare workers. This is a vulnerable population, and for reasons that we don't entirely understand. So what we saw in Wuhan, 1,000 healthcare workers became infected with this virus, and of those, 15%, I think it was 14.8%, had severe illness, many of which required ICU admissions. And so that's another population that we really have to look out for, and that has a number of ramifications. If we start seeing a significant percentage of our healthcare workforce put out of commission because of quarantine or self-isolation, that's going to have big implications in any community that's trying to take care of very, very sick people. The other that I'm very worried about is we don't want to see a situation unfold where colleagues are taking care of colleagues in the intensive care unit. We did that once and it didn't go well. We had that situation in Texas Presbyterian Hospital in Dallas when the two ICU nurses became infected, and that was an untenable situation. It was highly demoralizing for the staff. So I think those are the two populations I'm most worried about. There are others as well. Our first responders, that's going to be important to protect them because we saw how right now we're already in Seattle, a number of first responders have now had to self-quarantine. And if we start knocking down first responders, getting them out of the workforce because of self-quarantine, it's pretty obvious what kind of situation that will create. And we don't want to start having to call in units of the National Guard. So it's important we protect those populations as well.
Dr. Hotez, tell us a little bit about how worried we should be for children and young families.
Well, that's an interesting phenomenon that we don't really understand. We're starting to see that so far in China and pretty much here, for reasons that we don't understand, young people don't seem to get very sick from this virus. And so it's very different from flu, for instance, which affects the very old and the very young. We're not so far seeing that very young component. Exactly why is a bit of a mystery. There's a lot of speculation among scientists. There are other types of coronaviruses that cause upper respiratory infections. Maybe they're highly present in China and they're providing some level of protected immunity, but that's still a medical mystery why young people don't seem to have a big problem with this infection. Now, remember, we're still really early on in the epidemic in the U.S., and although that didn't seem to, it seems that children are not at high risk in China. It's still too early to say for certain that this is not going to be a problem here in the U.S. So we have to put an asterisk on that and say it's still early on.
Very good. All right, let me bring up another physician, and then I'm going to open it up to questions from the media. We also have with us Dr. Amy Arrington, and she is at Baylor College of Medicine, Texas Children's Hospital, and she's the head of the section on global biologic preparedness. So come on up, Dr. Arrington.
Good morning, everyone. So my job at Texas Children's is to serve as the medical director of a special isolation unit. So as Dr. Hotez was speaking to, I think it's important to learn lessons from emerging infections and outbreaks. And back in 2015, with the Ebola outbreak and the patient in Dallas, we decided at that time to build a unique state-of-the-art biocontainment unit specifically for children. And that is an 8-bed unit that's housed in the West Campus of Texas Children's Hospital in Katy. And this was part of a larger vision, knowing that emerging infections will occur and continue to occur in our world today, and we wanted to be prepared for it, as we always do at Texas Children's, to give children and their families the highest possible care. This unit is state-of-the-art. It's 8 beds. It is a full biocontainment unit capable of full isolation, including HEPA filtration, special autoclaves for high-level trash. We have a in-house unit or a laboratory within the unit. We have special quarters for staff as well. And it's a special unit specifically for children. We not only have this unit, but we have built a team around that who is prepared and highly trained to take care of children with any special infection. So we thought of this not just for things like Ebola or COVID-19, but for MERS and SARS and avian influenza, anything that we need to be prepared for as a community. And the thought behind this is to give patients the highest level of care possible, while at the same time protecting our staff, as Dr. Hotez mentioned, and protecting the community by being able to isolate. And lastly, I'll just say, in creating a unit such as this back 5 years ago now, it's elevated how we think about preparedness at Texas Children's. It's elevated our response and being prepared for things such as outbreaks like this. We continue to work hand in hand with the CDC and with our local and state health departments. And as this virus changes and we learn more information, we continue to change our screening protocols and offer the highest possible care for our community. Thank you.
Dr. Arrington, thank you very, very much. Let's open it up to questions. Where did Peter say he was going? He was just running off. Oh, he's coming back. He's coming back. Yeah.
I guess what steps should parents be taking right now to keep their kids as safe as possible?
I think what Allison mentioned with the CDC's recommendations, I mean, those are the basic things in terms of washing hands. If kids are sick, keep them at home. But I also think this idea of creating a plan, what are you going to do if the schools close down, I think is paramount. Because one of the things that we understand is during times when schools close down, it's when kids get into trouble and it's when kids get hurt. And so we need to make sure that we have a plan for how we're going to keep the kids busy. If indeed the schools are going to do a little bit of online learning, how do you have the wherewithal to do that in your home? I think that's a very important thing as well. But I think we also should understand that while kids are less likely to get sick, they also can transmit the disease. And so making sure that they're staying away from frail, older adults, older people, I think that's important. Would you add anything to that, Dr. No? Okay, very good.
Parents who have children who have a compromised immune system, I mean, are they, I guess you handle that on a basis. How does that work?
You want to do that, or Dr. Arrington? Come on.
So I think for families that do have children with special health care needs, it's very important to monitor the children closely, stay in close contact with their specialists and their pediatricians to make sure that any symptoms are addressed appropriately.
Very good. Yes, ma'am.
Sorry, I didn't mean to cut you off in the last part.
That's okay.
It's obviously getting ready to be spring break time. So
Yeah.
the question is it okay to put your child on a plane, train, automobile, whatever, during this time where people either already have the plans or thinking about doing something? We know people are erring on the side of caution, but realistically, is it okay for the most part, unless you're going to some of these troublesome areas, to travel for spring break with your kids?
Dr. Arrington, should we be going down to South Padre Island for spring break with the kids?
I think South Padre is fine. I think that's a difficult question, and at some point, I think all of us have to make an individual choice. There are absolutely countries that are on the CDC and State Department list for either recommended to reconsider travel or no travel. And if you look, I look on a daily basis, if not more, several times a day, on if those sites have been updated. So Italy, Japan, Iran, of course China, Japan, these are places that are now, on the list of probably shouldn't go there or do not go there. I think places that get a little more tricky are, would you want to go to Seattle right now? But when I think about this for myself, you have to consider, your family. As you talked about, do you have special medical needs? Are you immunocompromised? But then also, I think we have to live our lives and continue to, carry out plans as usual to the greatest extent we can while at the same time being safe. I think I would anticipate that a lot of companies and institutions and organizations will start limiting travel. And we just have to, this is very fluid and changes on a daily basis. So to answer your question in a very long way, I think at some point you have to make a personal decision on what's best for you and your family, knowing that you may get quarantined, because some of these travel changes occur, at the end of the day when you've already gotten on a plane. And so just keeping that in mind, being flexible, and as we talked about, having a pandemic plan for your family. What will you do? How will you deal with this? And just being prepared. It's all about really being prepared as a family and as a community.
Well, in terms of crowds at airports, things
Yes.
like that, or I'm asking myself, I have a 1-year-old, we plan on flying to Florida next month, even just having them those kind of compressed situations like an airplane, I guess we'll have to see how it plays out. But at this point today, is it still kind of family decision?
Yes, and I think you just have to look at where you're going. The CDC, I will refer you constantly to the CDC's website, which I think is beautiful. They've done an excellent job on many different levels. Travel is one of them. They have a map of the world now, but particularly of the nation, and you can click on any state, anywhere you're going, see the case count, make a decision based on that. I think it'll be difficult to give specific guidance on should you go to Oklahoma City tomorrow. At some point, you're gonna have to make the best decision for your family, but also base that on common sense and what's going on in that region at the time. And then absolutely, like we talked about, wash your hands. I can't say that enough. Wash your hands. Don't touch your face, which is a horrible habit most of us have. It's very unconscious or subconscious, but try to get out of that habit. Clean your phones, things that are fomites and carry germs, but just practice good infection control, and that is by far the best thing we can do.
¿Nos puede decir en español, por favor?
Sí.
¿Es seguro que las familias viajen en esta temporada de vacaciones de primavera?
Mira, algunas palabras en español. Mira, sabemos que para nuestras familias con jóvenes y familias joven, que no estamos tan preocupados para ellos, pero cuando tenemos adultos que son un poco más viejos, estamos muy preocupados. Para viajar, sabemos que la economía va a ser afectada en el futuro en el cerca futuro. Así que para nosotros estamos diciendo a familias, tienes que ver lo que está pasando en el futuro, lo que va a pasar, y tal vez es mejor no viajar, trabajar si puedes, ganar dinero, porque van a ser algunas semanas en el futuro donde no van a poder trabajar. Sabemos también que para familias, nuestros niños, el tiempo va a venir donde las escuelas están cerradas, y familias tienen que preparar para ese día cuando esas mismas escuelas están cerradas, y es una cosa muy difícil para familias, sabemos eso.
¿Qué es más peligroso ahora para un niño, el coronavirus o la influenza B?
Para los niños es la influenza B, pero si tenemos las vacunaciones, todo está mucho más mejor. Es muy importante para familias documentado o undocumentado que tienen ese mismo vacunación sobre la influenza B, porque eso es mucho más peligro para nuestras familias jóvenes y para nuestros jóvenes.
¿Creen que los distritos escolares deben desinfectar, enseñar a los niños a lavarse más las manos, a usar el gel antibacterial?
Otra vez, por favor.
¿Cree que las escuelas deben desinfectar escritorios, dar a los niños más gel, que laven las manos más frecuente?
Sí, es muy importante que laven las manos, que si están enfermos se queden en su casa, muy importante. Sabemos que cosas van a cambiar día por día, cosas cambian, pero para nosotros sabemos también que si lavan las manos, si se queda en casa cuando está enfermo, la población está mucho más mejor para la población.
We've seen a lot of stores run out of some of the supplies,
Yeah.
disinfectants, even soap. Just kind of broad picture area-wide, do you feel like the schools here, the districts, have enough of those supplies to be able to limit the spread of any germs potentially?
I think it's pretty clear that the schools don't have all the supplies. I think that no one seems to have all the supplies that they really need. I think this is going to be a very difficult time for our schools. They're making very nice plans, but I think it's going to be very difficult because we're going to have, for the first time in our history, this opportunity to do more online learning using technology. It's really never been done on this scale. And if indeed these schools close down, you're going to have to see teachers working remotely. You're going to see others working remotely. I think there are some big challenges ahead for schools. I think we all hope we don't have to have those challenges, but I think it's certainly a big possibility.
What's the threshold, you think, for making that call? What percentage of
Wow.
population there is?
Yeah, Allison, do you have an idea on that? What do you think?
Well, it varies depending upon the disease. In some of the cases where flu caused schools to close down, it might be about 25% or more of the student population has flu. With the coronavirus, we really are learning more and more about it every day. So we don't have a particular number, but the health officials in a local jurisdiction, if they determine that it's necessary to close a school to protect the public's health, then they have the authority to do that.
We already see a lot of the corporate world saying there's no more travel that's going to be allowed. And so we see a lot of this beginning. I think it's not that far away. If we have a couple more cases, I think it's likely that you'll start seeing some of the smaller school districts decide to shut down. I think we need to understand that it's a hardship either way, right? It's very hard on families when it begins this whole thing of families needing to stay home, not being able to work when we shut down the schools. But we have a lot of trust, though, our schools are going to make the best possible decision on this.
The question he asked about flu B and comparing that.
Yeah, sure, yeah. Isn't that good? So the Spanish question now gets to be translated into English, right? So the question was, for children, is the influenza B indeed more dangerous? For children, actually, when you just look at the pure numbers, influenza B is more dangerous, but it's real important. And right now in Harris County, in our area in Texas, the rate of flu shots is low. The rate of immunization is low, and that has a very big impact on the danger of influenza B. And so certainly getting those flu shots for young families, for children, it's real important. Dr. Misra, do you want to comment on that as well?
So although we know that COVID-19 may not be affecting children as strongly as it is affecting adults, we really should worry about the flu right now. We're still in the peak of flu season. A child in Houston at this point is much more likely to come across someone that has the flu and get infected. We've had over 100 pediatric deaths this year from the flu in the United States. So every child under the age of 18, it is a strong recommendation that they receive the flu vaccine. The flu vaccine is still available. It will be available through June. So if your child has not been immunized, this is the time to do it.
Dr. Samber, en español,
Sí.
¿Cuál es el lineamiento o las instrucciones que los distritos escolares en estos casos tienen que tomar en cuenta para decir no hay clases? ¿Qué es lo que determina que pudieran tomar una decisión así?
Do you know the answer to that? Yeah. You speak a bit Spanish,
Well,
right?
basically I was...
No, I know, yeah.
No hablo español, pero no, I don't know the answer.
Sí,
Is it like we need maybe to analyze some possible cases or...
cuando hay más casos aquí en el condado de Harris, cuando hay más casos aquí en Texas, las escuelas van a empezar a decidir cuándo van a cerrar, porque sabemos que cuando personas se pasen, cuando personas están muy enfermos, las escuelas están muy preocupadas de qué va a pasar con esos mismos niños. Así que eso puede pasar en algunas semanas, pero vamos a ver lo que pasa con el coronavirus.
Ahora, sobre los productos de limpieza, usted mencionaba
Sí.
que no están preparados realmente los distritos escolares y también muchas empresas que no tienen los materiales necesarios para la limpieza de todas las áreas.
Sí. Mira, sabemos que, porque porque la población está comprando todo lo que puede comprar. Sabemos que en muchos de nuestros distritos escolares no tienen todo lo que necesitan para limpiar. Pueden limpiar, pero es el Purell que no lo tienen, que muchos no lo tienen, pero sabemos que están tratando para un buen salud para todos. Así que sabemos que las escuelas están trabajando mucho para esto. ¿En español quiere decir algo? No? Okay.
I think one of the questions that we continue to receive from parents is, okay, well, what should we do or what shouldn't we do with our children as far as health precautions, whether that's the hand sanitizers or do we take them to practice? I know it's difficult to put a general blanket statement on that, but is there anything overriding over the top of it that you could tell parents to try to give them some guidance on that?
Dr. Mason, do you?
So all healthcare providers right now are just referring back to the CDC. We just don't have enough information to give specific guidance, but we're trying to limit the infection spread. So all infection is spread contagiously from person to person, and the only way to minimize that is washing hands, coughing into our arms, and just limiting the amount of time you spend in public areas, because obviously the more you are in contact with other people, the more likely you are to become in contact with a contagious disease.
To that point, I think that's the biggest fear, whether it's legitimate or not right now in our community, is the spread now that cases are starting to pop up. What specifically have you learned from a healthcare point of view with the Seattle situation? What kind of lessons specifically have you learned from that situation that we're going to apply here?
So the lessons from that situation, one is that older people are at more risk of infection and more severe infection. So protecting them, keeping them isolated, and making sure that we're following them, especially if they are known to have come in contact with someone with COVID-19, we're watching them very closely. As far as school closures, we do know that COVID-19 is likely more contagious than flu. So although a school that has 25% of cases with 25% of the population with flu would be likely to close, the number may be much lower for COVID-19, and if there's just a few cases, it is possible that a school would consider shutting down the entire school for that reason.
Very good. Dr. Arrington, would you have anything to add on that?
Yeah, I think I agree.
You mentioned the Texas House hearing next week.
Yeah.
Is there anything specific you'd like to see from the government, or it could be from health agencies too, that's not being done right now, that you would like to see being done?
I think this commitment to transparency, I think if this becomes more serious, there are people who are going to want to downplay it because it's going to have such a big impact on our economy wherever this happens. And I think so this commitment to transparency, I think, is important. I think also a commitment to the public health infrastructure, to first responders, as Dr. Hotez said, to health workers. It's something that's very, very important that we continue to make that commitment. And then I think also that during this hearing we pay attention to this impact on our schools. And I think public education also the Public Education Committee needs to start talking about what does this mean for our schools as we have these types of crises. And this may be a once in a century type of crisis, but we're going to need to respond to it accordingly, and it means we need to work at it.
And just a clarification for Dr. Arrington, this 8-bed unit that you were talking about earlier, that already existed or that was put in place?
So we built that in 2015, and really I think the unprecedented Ebola outbreak was a stimulus for that, but it really serves as a biocontainment unit for any special infection, whether that be airborne or bloodborne, like hemorrhagic fevers. So the unit and the team trains every 3 months for the past 5 years. It's all volunteer. It's every personnel that you would need to staff ICU capable beds. So nurses, physicians, respiratory therapists, lab personnel, even our housekeeping staff trains with us every 3 months so that we're prepared to take care of children with any highly infectious disease.
One more question we got sent in. You mentioned a large number of uninsured kids in Texas.
Yeah.
We wanted to know if those kids will be covered on the cost of a COVID-19 test.
So I think this is one of the things we're pushing for with this new public money that was just approved in Washington, is to make sure that everyone, documented, undocumented, covered, uncovered, that they get this opportunity. This is a threat to public health. And so we don't want anyone to have any hesitation about getting tested or seeking medical help. And so this is quite important that we make this commitment that everyone is going to be able to be tested and treated should the need arise. Sí, es muy importante. Sabemos que vamos a tener más dinero aquí en Texas del gobierno federal para el COVID-19, para el coronavirus. Y es muy importante que podemos cobrar sin documentado, indocumentado, si tienen insurance o si no tienen insurance, que cada persona puede tener ayuda para el coronavirus. Es muy importante que todos saben que pueden cobrarlo y que pueden tener ayuda de salud para esto. Okay.
Timeline on the vaccine, when the vaccine could be ready?
Yeah, go ahead.
So there's two basic steps. One is vaccine development, so creating the vaccine, and then the second part is the testing through an FDA approval. And so right now there are expert researchers right here in Houston and elsewhere working on creating the vaccine. The next step would be the FDA approval process. That takes some time because it has to go through safety testing. And so right now we aren't looking at a vaccine being necessarily available possibly during this outbreak right here, but rest assured that the finest minds in the world are working on that. And also rest assured that they have, the federal government has recently clarified that once a vaccine is approved as safe for the American public, it is covered under the preventive vaccines under the Affordable Care Act regulations. So it will be available and a covered vaccine once it is available.
Okay, guys, we're going to have a meeting for the general public now, or for some people from the public to talk about some of these same items. Dr. Hotez, Dr. Arrington, Allison, Dr. Misra will all be here speaking as well. And so you're welcome to join, but we're going to break up now and go into our conference. All right? Thank you all very much. Yeah. Thank you, guys.
Thank you. It's so hard to talk about.
Oh, I know. But we try. Because they need as much information as possible. There's Dr. Hotez.